So, I have been helping a lot of clients and people that I speak to with Breastfeeding USA as a peer counselor with nipple trauma. And this is something that is quite common, but just because it is common, it does not mean it is normal. And my guest from episode 67, Shelly Taft, who is a wonderful IBCLC who helped me with my second child, talked about having severe nipple trauma with her children. And so I thought that it would be a good idea to discuss the causes of nipple trauma and then what the studies show are effective. Because when you go into mom groups and breastfeeding support groups and postpartum support groups on Facebook, you see such a wide variety of suggestions on how to prevent and help heal nipple trauma that I think it's time to put something out on the Milk Making Minutes for those of you who use this as a primary source of information or to share with clients so that we can get some good evidence-based information out there. So let's get into it.
When I began breastfeeding, I was blindsided by how difficult it was. I may have thought I was prepared, but having known only a handful of people who had ever breastfed and only seeing it up close from a couple of them, I had a huge learning curve. Since then, I've become a doula, a lactation consultant, and a childbirth educator. I'm your host, Lo Nigrosh, and I welcome you to the Milk Making Minutes, where we explore breastfeeding experiences through the lens of systemic barriers, so that you know your breastfeeding struggles are not your fault, and your triumphs really are the miracles you feel they are.
Okay, so many of us have been there. And because you hear from your friends and from family members, oh yeah, my nipples hurt so badly when I first started breastfeeding or when I first started feeding my baby from my body, we think it is normal to experience nipple pain. But nipple pain when you are feeding your baby always indicates that there is something going on that should not be. And often it will get cleared up within the first 6 weeks as the baby grows and as mom and baby learn better positioning and as the baby learns a deeper latch. And then that nipple pain goes away. But in the meantime, the person who is feeding the baby is suffering unnecessarily because even though many of us experience nipple pain, it is an indication that something is off. So, what could be off? Positioning could be off. It could be abnormal tongue movements due to a variety of things, and we'll get into that. It could be some interactive factors that are being caused by the baby, or it could be factors that are being primarily caused by the parent who is feeding. So, when it comes to positioning, newborns have very little head and neck control. And that primary positioning that we see in photographs, on breastfeeding advertisements, of that kind of upright baby feeding position that is really best suited for baby feeding dyads who are well experienced and for babies over 6 weeks old to have much better head control. So for brand new babies, a more laid back position or a sideline position where babies don't have to hold up their head as much or where the parent is not having to use as much muscle control to hold up the baby are going to make it a little easier for the baby to get more mammary tissue into the mouth. So often, if the position is such that the baby is needing to use a lot of muscles in the head and neck, then it might mean that the latch is not going to be ideal, and that will lead to nipple trauma and severe nipple pain. We often say in the field of lactation, when we are looking to see positioning, we want to see the alignment of the head, shoulder, hip, and feet. So we want to see baby straight on. So you want to see baby's body on top of the parent's body. So a straight alignment. So if you think when you have the baby towards you, you want to see the baby tummy to tummy, however you're holding the baby. So if the baby's neck is ever twisted during that positioning, think of it as if you are trying to take a drink of soda with your neck twisted to the right or to the left. That would make it a little harder to drink if you are not facing whatever you are drinking straight on. So, alignment is really important when it comes to positioning. When it comes to alignment, that can lead to abnormal tongue movements, as can having oral restrictions or some baby factors, such as having aversions. So let's say that there was routine suctioning after the birth, which is more commonplace than it needs to be. That could cause poor tongue movement or a shallow latch because it creates an aversion to having anything in the baby's mouth. It can create a negative association to being in there and can cause a shallow latch, or it can cause abnormal tongue movements. Any sort of tethered oral ties, early exposure to artificial nipples, so early exposure to pacifiers or to bottle teats can sometimes cause abnormal tongue movements, especially if there are any other factors that the baby is dealing with, like tongue tie, high palate, any other factors like that. So sometimes there are interactive factors that we need to be aware of, like labor meds can make it difficult for those initial latches, which can then cause nipple trauma, which can then lead to weeks of pain because the trauma has already happened. Any unnecessary separations in the first 24 hours can lead to shallow latches, an interruption in that early feeding can lead to nipple trauma. So it's just something to be aware of when you're thinking about those first few days after the birth. Some other factors that could be caused from the baby are pain from a birth injury, aversion to sucking because of rough handling. So, if a lactation provider comes in and they're in a rush because they have, or a nurse even, they have a lot of people to see and they just want to help the dyad to get feeding quickly, and they shove the mother's body into the baby's mouth, that rough handling can lead to a feeding aversion, which can then lead to either unusual tongue movements from the baby or a shallow latch, which can then lead to nipple trauma, which can then lead to weeks of discomfort. Any variations in the baby, like the high palate, airway abnormalities, any cardiac difficulties or illness from the baby can lead to shallow latches or unusual tongue movements, which can then lead to that nipple trauma. Any factors from the parent could be birth pain or trauma. Taut mammary tissue, size or shape of the nipple or the mammary tissue. And then something else to consider, sometimes you have a baby that has a very tiny mouth and then a parent that has a large nipple. Usually the mammary tissue doesn't matter as much, the size of the mammary tissue, but if the nipple is quite large, if there's a mismatch there in the first few weeks, that can lead to nipple damage, and then that can lead to severe pain. So then let's talk about some strategies. First of all, there is Nancy Moorbacher. She is an IBCLC. She has a YouTube channel. She's written lots of books for lactation professionals. She does lactation trainings for lactation professionals. She wrote a book for LCs and other professionals called Breastfeeding Answers, a guide for helping families, which I use as a primary resource. And she worked with a wound specialist to develop a standardized rating system for nipple trauma so that when lactation consultants are consulting with other providers, there can be a standardized naming system to name how severe the nipple trauma is. So it goes all the way from stage 1, which is superficially intact. It includes pain or irritation without any skin breakdown, to stage 4, which is full thickness erosion of the nipple. So it includes deeper damage through the dermis, and it may include full erosion of some parts of the dermis. So the nipple trauma can get quite severe when people are very determined to feed their babies with their own bodies and are just curling their toes through the pain. Um, so you want to make sure that if you're feeling any pain at all, that you really do seek out care so that you do not get to that point. So, the comfort measures that you can take when you are feeling pain, there is not a lot of data out there about what is most effective. So, first of all, I always recommend that you tune into your body and that you figure out what is going to work best for you, because only you know what feels best. But first of all, you really do need to figure out the causes, because if you don't know whether or not your nipple pain is being caused by unusual tongue movements or by a shallow latch or by poor positioning, then the nipples are going to continue to be damaged. So it doesn't matter how much lanolin you use. The lanolin, for instance, is just going to be to help you feel better, but the tissue is going to continue to be damaged if you do not solve the cause of the nipple trauma. So, the treatments for nipple trauma, you can take an analgesia that is compatible with your health history just to provide some pain relief. You can stimulate a milk ejection first by expressing milk or pumping, and that way there's not a baby on a dry nipple, and sometimes just having that milk on there will create a little less friction and make it a little easier to nurse. You can nurse on the least sore side first. Sometimes there's one side that is definitely more painful than another side. So it's fine to always start on the least side. And then once that side has been complete, move to the more sore side. Sometimes a baby will nurse more aggressively at the beginning of the feed, and so it is totally fine to start out on that side that is least painful. And you can wear breast shells between feeds to reduce the friction of the clothing or the pressure. Just make sure that those shells have a big enough hole so that they're not pressing into the nipples, because that can increase your risk of mastitis to have extra pressure on the breast tissue. And then use nursing positions that allow for the baby to kind of lay back onto you. And if you're not able to find the cause of the nipple trauma, varying up the positions can help to spread out the nipple trauma so that you're not always getting the trauma in the same place on the nipple while you're trying to figure it out. And then, of course, if the pain is too intense and you are still wanting to feed human milk, you can always switch to hand expression or to pumping in the meantime while you're trying to figure out the cause. So, then what do you do to heal the nipple trauma while you're figuring out the cause? So most people use either Dr. Jack Newman's Apno all-purpose nipple ointment. I used it. It was prescribed to me by my midwife with my first son. There's really not a lot of conclusive evidence that it works. Um, it is a combination of an antibiotic, an antifungal, and an anti-inflammatory, and a pharmacist mixes it up. And they suggest applying it sparingly to the affected nipples after feeds. But in a Canadian double-blind randomized clinical trial that included 151 mothers with damage to one or both nipples, all mothers received help in getting a deeper latch. They were then assigned to one of the two treatment groups, the APNO or the lanolin group. The researchers followed the mothers for 12 weeks. At 1 week, there was no difference in pain scores between the two groups. And at 12 weeks, there was no significant difference in breastfeeding exclusivity and duration. They concluded that the apno was no better than lanolin in treating nipple trauma. So as far as lanolin goes, there's some studies that compared using lanolin to expressed milk for nipple pain and trauma. They did find that the lanolin was more effective than expressed milk in some studies, but the research is mixed. And then the other thing that people use is virgin olive oil or virgin coconut oil. And this has found to be um, pretty effective. In a Turkish study that compared the use of olive oil with lanolin to prevent nipple pain, the researchers found that 53% of the study mothers preferred the olive oil and only 16% preferred the lanolin. And they seem like a logical choice because they are inexpensive and many families already have them on hand in their kitchens. Warm water compresses are a good option just to have something warm on there. And they're easily available, and sometimes you just need something wet on the nipple to kind of heal that wound. And then often silver cups are recommended. You'll see a lot of midwives and lactation consultants recommending them. They are kind of expensive, and often midwives and lactation consultants will have them for you to borrow or to rent. So there are some studies that show no big difference between using them and using expressed milk. But then there are other studies that do show a significant difference on days 7 and 15, that the pain scores were significantly lower in the silver cup group and that they appeared to heal faster. But these studies have a small amount of women, like 40 women, and there's definitely more research needed. But it can't hurt if you have the funds to buy the silver cups. Silver is a natural antibacterial and non-toxic material, and it's not absorbed by the skin. And so if that's something that you want to invest in, it's not harmful to wear those inside of your bra. Okay, so those are some of the treatments that are easily available. But of course, the biggest way to make sure that you don't have nipple trauma is to really just get the help you need. And if you are experiencing pain and you don't know why, I would love to be a part of your support team. So please reach out to me. You can find me at low@quabbinbirthservices.com. And I would love to do virtual consults with you if you are far away, or in-person consults with you if you are close to me regionally. And right now, during the Hanukkah season of 2022, I am hosting a Hanukkah gift contest. If you are a member already of my Milk Making Minutes community group, or if you join the group and you share my podcast with a friend or a family member or a stranger, and you share that screenshot with me, and then you leave a review of my podcast, or if you don't have the review app and you follow me on TikTok and Instagram, then for every 10 people who do that, I will gift one virtual consult to somebody, and you can keep it for yourself or you can share it as a gift. Please join that contest. I want to get the word out about my services, and I need more reviews of my podcast and more members in my community so we can be talking about the factors that make baby feeding difficult for everyone. So happy Hanukkah to all who celebrate, including my family, and love you all, and I'll see you in the Milk Making Minutes community group.